Thank you all for being here tonight and for your great support of this event for the past almost 15 years. I hope you're enjoying the new venue and the new ambiance. Walt, that's me. Yeah. I thought it captured everything. Well, I won't start over again. I'll just thank everyone for being here, and I wanted to say that the video you just watched was a nice overview of some of our accomplishments and contributions to cancer therapy during the past 23 years. Our major focus has been immunotherapy, the notion that one's own immune system can be activated to recognize and kill cancer cells. Immunotherapy is not a new idea. It wasn't a new idea 23 years ago. It's actually been around for more than 100 years. There's always been a great scientific rationale for immunotherapy, but for a very long time, which unfortunately encompasses most of my entire clinical career thus far, there was little evidence of clinical benefit with all the immunotherapy we gave patients. That's except for an occasional, almost miraculous example of tumor regression that we would see in our patients. In fact, tumor regression was so uncommon that when we started 23 years ago, the whole idea that doctors would someday be able to manipulate the immune system in a way that we could fight cancer was met with a lot of skepticism. Many members of the scientific community held the view that immunotherapy would never work as a cancer therapy. Despite this skepticism, we continued to believe in the power of the immune system and refused to give up what we thought was a promising strategy. With the support of Providence and the support of many people in this room, we built a great team, and together we learned more about the immune system and cancer biology. Armed with this knowledge, we were able to bring new innovations from the laboratory to the patient's bedside. The best example of this is the OX40 you heard about earlier from Tyler. The project was led by Drs. Weinberg and Dr. Kurdi, both of whom are in the room tonight. The OX40 discovery was a local discovery. It was fueled by local philanthropy and led to creation of a biotechnology company called Aganox, who sublicensed OX40 to one of the largest pharmaceutical companies in the world. So what started as a 30-patient, locally funded trial here in Portland, Oregon, is now being tested in hundreds and hundreds of patients throughout the world. Now, in the past 10 years, we've actually witnessed more progress in cancer therapy than in the previous 100. When we began our work at Providence, immunotherapy was the focus of only a handful of centers, and now it is a major component of every cancer center in the US. Immunotherapy was named a Breakthrough of the Year by Science, one of the top journals in the world. Immunotherapy has also been on the cover of Newsweek, the cover of Time. There was a recent 60 Minutes episode about immunotherapy. And I think all of you are aware that it's a major focus of Joe Biden's Cancer Moonshot initiative. Many of you also have probably seen the television commercial for Opdivo. That's an immunotherapy drug that we offered to patients in clinical trials here in Portland many years before it was approved by the FDA. Access to this drug was the reason that my patient, Julie Randall, came to Portland from Australia a few years ago. At that time, it was only available on our clinical trial. One year ago, it was at this event when it was a luncheon that Julie was our guest speaker, and Scott, once we found him wandering around the bowels of the convention center, arrived to give his part of the speech. And we were very fortunate to hear from them what it meant to their family to be so lucky to receive a drug, to receive a drug available to only a handful of cancer patients in the world. I am happy to report that Julie is doing well and has been receiving immunotherapy down under. I get a wonderful note from her oncologist, and every few months I get a note from her oncologist every few months and occasional pictures of, thank you, of Julie with her family or playing football on her Australian rules women's football team, if you can believe that. This is a picture of Julie and Scott in New York City. They were back in the States because, I'm sorry, the picture just went off, but they're back in the States because people who viewed their presentation last year thought it was so wonderful that they invited them to come back to speak to other patients about what it's like to get cancer therapy and be a cancer survival. So this is one of the magical benefits of innovation. And behind every breakthrough like this, there is a team with an idea, a vision of how things can be done differently, and a willingness to try something new. There's no denying that this is a very, very exciting time in cancer research, and for all of us who've been in immunotherapy most of our lives, it couldn't be any more exciting. But despite the progress that has been made, we're still pretty far from where we need to be. The harsh reality, and you heard a little of this from Tyler, is that 40% of people diagnosed with cancer still die. And they die because for them, current therapy is not effective. Unfortunately, as a practicing oncologist, I get to know this all too well. My patient, Karen, who was also a speaker at this luncheon a number of years ago, and you can see her pictured up there, lived substantially longer and had the gift of many months and probably a couple years of life from immunotherapy for her melanoma. She experienced quality time with her friends and family, and here she is pictured with her best friend on a memorial bench, her friends dedicated to her on a beach in Yachats. She died before she could get access to the drug that actually saved Julie's life, one of the downsides of what we do. We are justifiably proud of these advancements, but I am all too frequently reminded of how much work still needs to be done. 2 of my patients died in the last few months, a young man and a young woman, both in their early 30s, both with melanoma, one unmarried, the other looking to start her own new family. They had melanoma, a disease that these new immunotherapies are supposed to cure, a fact that they pointed out to me regularly in the last few days of their lives. Both of them participated in multiple clinical trials, including immunotherapy, and yet cancer still took their lives. So despite the recent progress, which is worth celebrating, which is part of why we're here tonight, substantial challenges remain because only a minority of our patients benefit from current therapy. Every advance in the treatment of cancer is a result of investment in research and in the laboratory scientists and physicians in the clinic who are trying new approaches and working tirelessly to move us forward. It will be clear to all of you tonight there is still a lot to do before we can lay claim to finishing cancer once and for all. This will require additional innovation. And who better to innovate than the next generation of well-trained physicians and scientists? The next generation will be our legacy, a legacy we must continue to build. I am counting on this next generation to finish cancer for us and to finish cancer for our children and our grandchildren. There they are. There they are. I've been trying to figure out for many years how to get them up here with me, but it's past their bedtime, and so Mom's right over here, ignoring the children at night. I mean, who can even think of the terrible thing of cancer affecting our children and grandchildren? And it's within our means to take care of it. And so tonight, we celebrate our accomplishments, but it's a celebration with a plea. We need to remember the 40% of patients with cancer that we still can't cure. Help us tonight by investigating in the innovative, bright minds of the future, the ones who won't rest until we finish cancer.